I'm Mary Sue McLaughlin.
I'm Dennis McLaughlin.
And we've been married for almost 40 years. And we live currently in Myrtle Beach, South Carolina. We moved here from Richmond, Virginia, about a year ago. Dennis retired. 25th of September, we drove over to Anderson, South Carolina to visit with his cousins. And I'd just gotten up out of bed. So I said, well, hurry up because we need to get downstairs and be with your relatives since we're guests here. He got up, got his clothes, and as he was going to the bathroom, he dropped his clothes on the floor. And I saw that happen, and I thought that was really kind of strange. A couple of seconds, probably about 5 or 6 seconds later, he comes back and reaches down with his right hand to pick up his clothes off the floor. And his hand is going into the motion of trying to pick it up, but he's not picking it up. And after the third time of trying, he stands up. And when he stands up, I notice that his face is drawn to the left side. So I look at him and I was like, oh my goodness, you're having a stroke. So I got him in bed, I had him to lay there. And then we called 911. I guess it was about maybe no more than 6 minutes when they got there to the house. And they were already upstairs. They were asking questions and stuff. Where his cousins stayed, it was about 200 yards from a school. And the chopper landed there at the school parking lot. And the medics took him, or the EMT group took him, by ambulance over to the chopper.
I'm Dr. Neel Shah, and I'm one of the vascular and stroke neurologists with Prisma Health. I practice at Greenville Memorial Hospital, and currently Greenville Memorial Hospital is the only comprehensive stroke center in the upstate. I was the neurologist on call for stroke, and Mr. McLaughlin arrived to us by EMS, and his symptoms included the inability to speak or comprehend speech, the inability to move the right side of his body, including his face, arm, and leg, and his eyes were fixed looking to the left. It was very clear that he was having a stroke, and the next step would be to determine if he's a candidate to receive any acute stroke treatments. The first is a clot-busting medication. And if the patient is not having a hemorrhagic or bleeding type of stroke, they may be eligible for this type of medication, and Mr. McLaughlin was. So he received the clot buster in a very timely manner in the emergency room. Next, we determine if the patient is a candidate for a procedure in which the clot that's causing their stroke could either be pulled out or sucked out. And we do that by looking at the blood vessels of the head and neck with a test called a CT angiogram. In Mr. McLaughlin's case, he was a candidate not only for the clot-busting medication, but also for a procedure called thrombectomy, in which we enter the blood vessels and either, again, suck the clot out with our catheters or pull the clot out.
They took us back to a special room, a private room in the stroke trauma center emergency room. And my cousin and I were sitting in there, and the doctor came in from ER and sat down, closed the door, and he explained in detail. He spoke on our level, or my level. He didn't speak above me, which we truly, truly appreciated.
After receiving the acute stroke treatments, Mr. McLaughlin was admitted to the hospital and underwent further testing as well as therapy evaluations.
One of the nurses came back to me. She said they just took him into the ICU stroke center. And she said, if it were my husband, I would want to be back there to see him. So she says, I'm going to take you back to go see him real quick. So I did. I got to go back and see him for just about a couple of minutes. But I tell you what, that was the biggest relief and biggest gift that anyone could have given me, because I got to see now for a fact that he was okay. He could now talk, he could say my name, and he can now move his right side.
He did very well. He was discharged 3 days after he was first admitted. And at that point, he had improved significantly. Essentially, he was left with some subtle difficulties producing speech and maybe some subtle right lower facial weakness. Other than that, he was freely moving his right arm and right leg. He was communicating quite well, and he no longer had his eyes fixed to the left side. He could look around freely. And so he did exceedingly well.
I can say a little bit. I mean, I really appreciate everyone at the hospital. Everyone's very, very good to me. I never. Basically.
It's okay.
I've never been in a hospital. Anyways, everyone's really good. All the people have been really helpful to me. I felt really, really good. That's what's happened to me.
Mr. McLaughlin is doing very well, and we expect him to continue to do so. And much of that can be attributed to the fact that his family recognized symptoms of stroke very quickly, and that EMS transported him and triaged him rapidly and appropriately, and that he received the acute stroke treatments that he was eligible for in a timely fashion.
Still a tribute to the medical staff there in Greenville. We will always remember them. Like I said, they have impressed upon our hearts and in our minds how much care and concern they have given and how much needed that they are. Without them, he wouldn't be the person he is today. So we truly appreciate all that they did for us.
Thank you very much.